Transient ischemic attack, often called a mini-stroke, is a temporary disruption of blood flow to the brain, leading to stroke-like symptoms that typically last only a few minutes to a few hours and resolve within 24 hours. While it does not cause permanent damage, it is a serious warning sign, indicating an increased risk of a full stroke in the future. Causes of DIA occurs when a blood clot or plaque temporarily blocks blood flow to part of the brain. The most common causes include blood clots, often from the heart or major arteries. These clots can travel to smaller blood vessels in the brain and cause blockage. Atherosclerosis, plaque buildup in the arteries can narrow them and lead to clots or reduced blood flow. High blood pressure, hypertension damages blood vessels over time, increasing the risk of clots. Heart conditions, atrial fibrillation, heart valve disease, or heart attack history can contribute to clot formation. Diabetes, this condition increases plaque formation in the arteries, raising the risk of DIA and stroke. Symptoms of DIA symptoms are similar to those of a stroke but are temporary and typically resolve within minutes to hours. Common symptoms include sudden weakness or numbness in the face, arms, or leg, especially on one side of the body, difficulty speaking or understanding speech, sudden vision problems in one or both eyes, dizziness, loss of balance, or coordination, severe headache with no apparent cause. The symptoms depend on the part of the brain affected by the temporary lack of blood flow. Diagnosis of DIA. Because DIA symptoms are short-lived, they may be gone by the time medical attention is sought. However, it's crucial to seek help immediately, as prompt assessment can prevent a future stroke. Diagnostic methods include neurological examination. The doctor assesses balance, reflexes, speech, and motor skills. Imaging tests, MRI or CT scan, used to look for any evidence of brain damage or blockages. Carotid ultrasound, checks for blockages in the carotid arteries in the neck. Heart tests, echocardiogram, assesses the heart structure and looks for clots. Electrocardiogram ECG detects irregular heart rhythms that may cause clots. Blood tests, these may check for cholesterol levels, blood clotting, and other indicators of stroke risk. Treatment and management of DIA. Treatment aims to reduce the risk of future TIAs or full strokes and may involve lifestyle changes, medications, or surgical procedures. Treatments include medications, antiplatelets e.g., aspirin reduce blood clot formation, anticoagulants e.g., warfarin, DOACs used in cases where there's a high risk of clot formation, especially with atrial fibrillation. Statins, lower cholesterol to reduce plaque buildup. Blood pressure medications, used to control hypertension. Lifestyle changes. Diet. A heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins can reduce risk. Exercise. Regular physical activity improves heart and vascular health. Smoking cessation. Smoking increases the risk of blood clots and stroke. Limiting alcohol. Heavy drinking can raise blood pressure and stroke risk. Surgical options. Carotid endarterectomy, a procedure to remove plaque from the carotid arteries, recommended if there is significant blockage. Carotid artery stenting, a stent is placed in the carotid artery to keep it open if it's narrowed by plaque. Prevention of DIA and stroke. Manage medical conditions, controlling blood pressure, cholesterol, diabetes, and heart conditions is crucial. Regular health check UPS. Monitoring cardiovascular health helps prevent TIAs and strokes. Maintain a healthy lifestyle, eating well, exercising, and avoiding smoking are powerful preventive steps. Recognizing DIA as a warning sign. Up to 40% of people who experience DIA may later have a full stroke, often within the next few days, so timely medical attention is critical. The FAST acronym helps recognize stroke symptoms. Face. Ask the person to smile. Does one side droop? Arms. Ask them to raise both arms. Does one drift downward? Speech. Ask them to repeat a simple phrase. Is their speech slurred? Time. If any of these signs are present, seek immediate medical help. Prognosis. Most people recover fully from a without permanent disability, but the risk of future stroke is high. Acting promptly and addressing risk factors can significantly reduce this risk. Conclusion: IDIA is a serious health event that indicates a high risk for future stroke. Early medical intervention, lifestyle changes, and treatment for any underlying health issues are essential to preventing a full stroke. Recognizing symptoms early and adopting a heart-healthy lifestyle are critical for long-term well-being.